today, as you know, we will have the... Okay, so in case you have a question, so you will write down in the chat, and then I will answer your questions. Okay, so okay, so I hope you see my presentation and you hear me. So Nano Uniqa, this is the first ever thread, APTOS thread for the delicate areas. So we don't have the same analogs of the threads on the aesthetic market. Why? I will explain you, because they are used mostly in a very delicate areas where most probably you will not be able to use the different type of the aesthetic materials, you know, so because there are risky in those areas to be used some materials, sometimes risky in terms not of the material, but in terms of the injection techniques as well, and so on and so on. So why this idea came to the APTOS? So why they wanted to create this type of the product? The first of all, me working in aesthetic medicine and all of our colleagues, we saw that, for example, there is nothing for the fine lines, kind of the thread, that can be used safely. Okay. Another thing is that in majority of the cases, these areas are supervascularized. Sometimes you may have the complications connected to the vascular occlusion, sometimes the Tyndall effect as well when we are using the hyaluronic acid, for example, and so on and so on. So the idea was to create something which is the biostimulatory and doesn't have the possibility of the migration, the possibility of the vascular occlusion, and so on and so on. So in which areas we use Nano on Uniqa? This is the forehead. This is the glabellar area, and you know that we don't have that much of the product used in the glabellar area, periorbital area, periauricular area, perioral area, and also neck, decollete area, and the dorsum of the hand as well, the palms, okay? So what is the delicate zones, the delicate area? This is the anatomically sensitive areas, well, where we have the very thin dermis, minimal of the subcutaneous fat compartments, and I already said that the supervascularized areas, and those areas are the higher risk, they have the higher risks of the complications. So why the complications happens in that areas? Because we said that the dermis is very thin. And if we will use the standard type of the threads, we might have the contouring of the threads, the visualization of the threads. This is a very highly the tissues with the high mobility as well, where usually we have early fine lines, early skin laxity in the tissue, and a minimal fat that makes the faster hollowing of those areas, okay? And you see the examples there on the slides as well. In mostly also, for example, the periorbital area, this is the area where we have the high sun exposure possibility. That's why we receive the faster photoaging of those, areas, okay? So what are the treatment options for delicate zones? Nowadays, we know that, right? This is the fillers, this is the EBDs, this is the toxins, the surgery as well, and so on. But what happens when we're using for example, the hyaluronic acid, the toxin, and EBD, and so on and so on? In the periorbital area, we have the highest complication rates. Usually, we know that with the hyaluronic acid. And neck and the decollete area, this is the lack of the effective non-invasive treatment options. So, for example, EBD or the hyaluronic acid boosters and the biorevitalization, they are not enough for those areas, okay? So what can give us, for example, in the different areas, those procedures on delicate areas? For example, fillers, hydroxyapatite calcium, PLLA, hyaluronic acid. What are the limitations in delicate microzones? For example, high visibility with some type of the threads as well, and Tyndall effect with the hyaluronic acid, risky near arteries, we know that. But Most common complications are edema, irregularity, Tyndall effect, bruising, and so on. Energy-based devices in those areas, because of the thin skin, we have one is either we don't have a very good results there, or another thing is that we may have some born risks as well, depending which type of the EBD we are using, right? This is the most common complication. Hyperpigmentation can be also achieved as a side effect and the complication from the EBD. Textural worsening, prolonged erythema, and so on. But with botulinum toxin, we are using botulinum toxin mostly in the dynamic wrinkles, not for the volume loss. We are not using them for the fine wrinkles. So that's why we cannot use the toxin in that areas. That's why we receive the complications like eyelid ptosis, smile asymmetry, lip incompetence, neck weakness, and so on and so on. With the surgery, we know that not all of the patients want to have the surgery. So this is very invasive. We are not talking about the surgery right now, but we are talking about the non-invasive, mini-invasive treatments, okay? So what another solution can APTOS give us? The Nano Uniqa, and let's compare, for example, what the Nano Uniqa, why the Nano Uniqa is so unique, right? So first of all is that vascular damage. With Nano Uniqa, we cannot receive that because we have the blunt tip cannula. Vascular occlusion? No, of course, because this is the solid material. So first of all, the thread is very thin, also with the blunt tip cannula, and of course the vascular occlusion risks are very low because of that, because this is not a gel, this is not the liquid. Vascular emboli, we cannot receive the vascular emboli with the Nano Uniqa because this is the solid implant. Tyndall effect, of course not, because this is the solid opaque material. Granulomas, of course not, still, because this is the solid material. Burns and hyperpigmentations, no, because this is not the energy-based device. And hypertrophic scars, no, because we have a minimal trauma and tissue response due to the material and the very delicate injection of the product. Why Nano Uniqa for delicate zones? High priority is that aging becomes visible exactly in those areas, and we don't have, as I mentioned already, that much of possibilities. High risks, the treatment is most technically challenging, you know, for the other type of the treatments. I mean, high interest because we have a high patient demand, but limited effective treatment options. So how the Nano Uniqa meets the requests and demands of our doctors as well. So the thing is that this box contains 10 threads, and those 10 threads are five separately packaged, you know. So we don't have one sterile packaging for all of those 10 threads, but we have 5 threads in one sterile package inside the box, and 5 threads in another separate sterile package. So that means that if you want, you can use 5 in one patient, or if you want to, you can use both of those 10 threads in one patient. It depends on you, right? So chemical characteristics. This is the PLLA PCL thread with the Uniqa technology plus hyaluronic acid. The size range is uncoated one is 7-0. Can you imagine 7-0? But after the coating, it's 5-0. So that means that these threads are almost like a hair. They're very almost invisible. I will show you during the live demonstration, and you will see it. So that means that the risk of let's say the visualization and the contouring of the thread is almost zero. Surface, this is the textured porous surface with nanofibers net with embedded nano to micro-sized capsules. And coating, this is the PLLA with the spatial HA coating with the Uniqa technology. So that Uniqa technology means that we have the target delivery of the hyaluronic acid in 1 month, in several weeks, in 3 months, 6 months, 8 months, and so on. So after your injection, we have the target delivery of those materials to the tissues. So we have two sizes of the Nano Uniqa, 5.5 for smaller areas and 8.5 for neck, for the decollete area, for palms, and so on and so on. So that means that you choose which size of the Nano Uniqa you are going to use in your patients. For example, the small one is used for the periorbital, glabellar, forehead, periauricular, perioral, and neck areas. And for the Nano Uniqa medium, which is called medium, 8.5 is used for the forehead, neck, and the decollete areas as well. So understanding the Namica technology, we all know what is the Namica technology, but what I want to tell you is that with the Namica technology, usually the Aptos produces the solid biostimulators, like the Excellence Visage, Visage Soft, Nano Excellence, and now Nano Uniqa as well, with the native hyaluronic acid. And with the Namica, why the name Namica comes from nano microcapsulation. On the coating of those threads, we have micro, submicro, and nano capsules outside with the shell of the PLLA and inside with the hyaluronic acid. That means that every time with the submicro, it has the most long-term action in the different time slots, right? And it delivers the hyaluronic acid to the tissues in the early weeks, after the months, and so on. But with the submicro, we have the delivery of the hyaluronic acid to the tissues after 1 and 3 months, collagen stimulation also. And with the nano capsule, we have the 3-6 months. It means that after your thread implantation, those threads works like a depot inside the tissues, and they deliver the hyaluronic acid exactly in those periods to the tissues, and means the tissue is all the time stimulated by hyaluronic acid for the elastin, for the collagen stimulation with the PLLA as well. So this is how the threads looks like with the Nano Uniqa, with the Namica technology coating inside. You see the micro capsules, submicro, and the nano capsules as well. And this is what's important you to understand, that the shell is done from every capsule has the shell of the PLLA inside with the hyaluronic acid. So that means that we have the stimulation both of the collagen type 1 and 3, and also the stimulation of the elastin as well. So where the name comes from, nano microcapsulation, Namica. Also, this is Georgian name term Nami, which means the dew, which means the hydration. It's very symbolic because those type of the threads mostly work for the biostimulation and the hydration. Okay, so what type of the effects has the biostimulatory effect has the Nano Uniqa? This is the tree stimulating composition, PLLA, PCL, HA. PCL helps in the formula for the PLLA to have a long absorption period. Okay, so we have the also the collagen stimulation, elastin stimulation, of course, and the main action is that the fibroblasts are activated with the stimulation. First of all, well, we know this, right? So first of all, starts the activation of the cytokines because of the local inflammation, and after that, the activation of the fibroblast, and then the new collagen and the elastin, and we have, because of that, the improved dermal structure, skin improvement of the skin laxity, skin firmness, and so on and so on. So collagen type 1 and collagen type 3, after the injection, we see that with every type of the PLLA, we have these results. But the blue one is the Namica technology. The highest one has the stimulation for the collagen type 1 and type 3, exactly the blue one, the Namica technology. And the thing is that with the Namica technology, we receive two types of the collagens, 1 and 3, but the majority of that collagen, 60% approximately, is the collagen type 1 and 40% collagen type 3. And that's amazing because we don't need that much of the collagen type 3, because we know that the collagen type 3 is mostly for the scarring, connective tissue, which is also important. But the collagen type 1 is more responsible for the improvement, skin laxity improvement, the firmness improvement. So what this means? So we receive 60% of the collagen type 1. The dermal structures are improved, but we have the less possibility of the later fibrotic tissues production. That means that tissues still are not that affected by the fibrosis after several months, after 1 year, and so on and so on. Okay, elastin stimulation also. All of those products give us this possibility, but the highest possibility for the elastin production as the Uniqa technology, the blue line you see, especially on the 14th day. Okay, so we see also the quite huge improvements and novelties with the clinical studies which we have already done. So and when we see that, so the collagen type 1 and collagen type 3 mostly is still preserved and even more increased after 19 days approximately. And this is very logical because the same is with the injectable PLLA as well. We receive the peak of the stimulation after 2 months, 3 months approximately. And you see those who understand the histology, you can see that the improvement of the elastin fibers. So you see there with the Uniqa technology, we talk about the Uniqa technologies. That's why you will see there the EVHA and EV, because this is the different thread, but the composition is almost the same. We talk about the affection of the composition, the formula on the tissues. You see on the day 19, the improvement, and you see on the day 180. Okay, with the elastin. But for the elastin, mostly responsible the hyaluronic acid. So the PLLA works on the stimulation of the collagen type 1 and type 3, and elastin also works on that. But mostly the elastin is responsible for the for the elastin is more responsible hyaluronic acid. So this is what the combination APTOS has created, that we need the combination of both of those materials, elastin and collagen as well. And even our new product, the injectable collagen stimulator, which we have Allure also, that's why it's combined with the hyaluronic acid, because the collagen is nothing without elastin. So this is I want to explain you somehow so that that you will not receive the complete result of the rejuvenation and the biostimulation with only collagen if you don't have the elastin. Okay, so that's why this type of the threads are very versatile in terms of receiving some results, so we don't have only the improvement of the fine lines, but in that area, because this is their age-related process, the hydration as well, and because of the elastin, we have also the improvement of the very superficial skin structures, and these threads are exactly for the superficial structures, dermis, a bit superficial fat compartments, so they give us the complete results. Okay, so first of all, the advantages of the Nano Uniqa threads: the target delivery of the hyaluronic acid and the material. Controlled release. What does it mean? I told you that the microcapsule delivers the hyaluronic acid in different periods after the injection. The nano submicro, then micro capsule gives us the delivery of the material after 3 months, after 3 months, and the nano capsules gives you delivery of the material in 6-8 months. Okay. So this is what I wanted. This is what I was explaining to you: the micro, submicro, and nano delivering in different time period the material to the tissues. The clinical benefits of the insertion and advantageous safety of those products. First of all, that what is very unique, dear colleagues, not all of us, we are working in the clinics. We have our private clinics as well, our private practices as well. And very often, the local anesthesia injection makes the problem for some doctors. because we are afraid of doing the anesthesia. These threads, they don't need anesthesia. We're not using the anesthesia even on the entry point. We're using just the local anesthetic solutions like EMLA, for example, on lidocaine, just like that. And then we inject it. Sometimes we don't use even the cream, lidocaine cream for that, okay? So no migration is possible because this is a very small and smooth thread, very small thread, very small diameter, and injected in almost intradermally. This is the only APTOS thread injected so superficial, intradermally, dermis, hypodermis. No possibilities of nodules or the granulomas because this is the solid material. Minimal risk of damaging of the anatomical structures and minimal inflammation, foreign body reaction, and so on. We don't have a swelling after that. Maybe we can have some small hematoma, especially if it happens here. It's very normal. It's okay, but it's not dangerous, So we talked about the benefits and advantages, and what I want to tell you is that this is one of the most effective threads I've ever had. The patients had amazing results even after 2 weeks. Why? This is not a myth. Why after 2 weeks? I already told you that with the Uniqa technology, these microcapsules, they release the hyaluronic acid sometime from the very first beginning, first 1 week as well, first 3 days as well. So that's why on WhatsApp micro capsules are working. Application areas. This is the forehead, glabella, periorbital area where we use the small threads, 5.5, which is called small. Face, preauricular, perioral as well. We are using the small, 5.5, and body, neck and decollete and dorsum of the hands, the palms. So how we are going to use them and what are the marking areas? Dear doctors, here is the marking areas for you to make the photos. But where is the entry point for the Nano Uniqa threads? Where exactly we enter, for example, in the forehead, in the periorbital area, perioral area. You need to remember, Nano Uniqa doesn't have any specific entry point. So you see the problem, go ahead. This is your entry point. So this is not the thread with the fixation. So that's why, dear colleagues, so for example, you see the problems on the crow's feet, you inject there. How many threads you inject there? It's up to you. You can use 5, you can use 10, you can use 20. Why? Because all about the diameter of the thread. This is 50 diameter. More you inject, more results you have. And this is the only thread. First of all, we said why it's unique. If we don't talk about the other benefits I already explained to you, another type of the benefit, this is the only thread you can exactly inject on the eyelids, not in the periorbital area, but eyelids. Yes, you can inject it on the eyelids. I will show it to you on the live demo. Then what you can use here the crisscrossing of the product. You can use here the linear injection of the product, and so on and so on. Okay. Then we can use in the preauricular area and the perioral area as well. For the decollete area, dorsum and the hand and the neck as well, and the palms as well. So make the photos of those markings once again. So you can use the only 5 threads, or you can use 5-5 with the crisscrossing technique, okay? Here we are. And where we inject it in the hypodermis, intradermal injection, okay? So here, one more thing, before and after. This is an amazing patient, and my patient actually. The thing is that, look at this. The photo was done on 22 of August. This is the quantifier. We cannot lie because the quantifier is doing it very well. 22 of August and result 10 of September. Let's see. Now you will say, oh, I don't see a big changes there. You can see like that. But this is the fine lines and very small lines. If you don't pay attention, you will not see that. But look at this. After 2 weeks, pay attention now. Look. Pay attention to the periorbital, the eyelid wrinkles, and on the periorbital area. You see now the differences, right? So this gives us a good result in a very short period. And here I used not more than 5 threads. 3 threads on the eyelids and 2 threads in the crow's feet. Okay, 5 threads. So can you imagine if I've used a bit more? And I will show you how to use a bit more in those areas as well. Now, about the PDO and VS threads. So why we are going to talk about this? Because there are a small, smooth mono threads done from PDO. You know, a lot of the doctors are using this, and a lot of us, we have used it as well. But the thing is that you need to understand that what are the differences in between them and how to encourage patient to start working to make the procedure with the Nano Uniqa. The first one is that composition, that the PDO has single polymer composition, only polydioxanone, but the Nano Uniqa thread is the copolymer. You have 3 different materials working on a different indications. This is the PLLA, not PLA, but PLLA. L isomer, the longest, the most effective one with the longest absorption period, the native hyaluronic acid, and the PCL, which prolongs the absorption period of the PLLA and works on the deeper layers as well. Biostimulation agent. We don't have with the PDO biostimulation agent. It works on the different type of the stimulation, which is mostly the collagen type 1 mostly, and but we don't have the agent there. Regarding the Nano Uniqa, we have the polycaprolactone as an agent, and polylactic acid is also an agent, and native hyaluronic acid as well. Mechanism of the biostimulation. With the PDO, it's done via controlled foreign body reaction, not direct affection by the copolymers. But with the Nano Uniqa, we have the combined controlled collagen stimulation and direct biological activation. Biostimulation with the PDO is very mild and very short. So you see here 3-4 months. And with the Nano Uniqa, I already talked that this is the very strong stimulation of the collagen and elastin as well, and extracellular matrix as well. Longevity is PDO 3-4 months, the absorption period. We all know that already from every congresses, the teachings, and so on. With the Nano Uniqa, because we have the L isomer of the polylactic acid, this is the 6 to 12 months. Degradation is the rapid hydrolysis with the PDO, really very rapid. That's why it's for 3-4 months. And with the Nano Uniqa, this is the very slow and controlled degradation because of the polycaprolactone in this copolymer formula. Hydration, the PDO doesn't have 0 point of the hydrating effect. But here we have the continuous hydration because of the native hyaluronic acid. So with the PDO, mostly we receive the mechanical support. And with the Nano Uniqa, mechanical support, gradual long-term hydration, and the biostimulation, improving skin laxity, firmness, and the texture. Okay, so Nano Uniqa vs injectable biostimulation. Injectable biostimulation is good, but in some areas. So why we are talking now about the delicate areas, about injectable biostimulator and Nano Uniqa. Anatomically safety. Sorry, the threads with the with the linear injection. Okay, so anatomical safety, they are injected linearly in a controlled plane with the blunt tip cannula. We already talked about the risk of the complications. There are no risk of the granulomas, the nodules with the threads, but there can be the lumps, granulomas, or vascular occlusion using the injectable biostimulators, for example, in the periorbital area. Product migration, threads are fixed intradermally and they don't migrate this type of the threats. But with the injectable biostimulators in those areas, for example, on the nasolabial fold, the marionette lines, they can migrate, especially in the mobile areas, okay? Inflammatory response minimally is with the threads are minimal, especially with the Nano Uniqa threads. They are very small and delicate threads. And with the injectable one, they can may cause the swelling, the Tyndall effect once again inside the periorbital area, and skin quality improvement. With this Nano Uniqa threads, we received a very improved skin structure in a very short period. But with the injectables, they are very limited in direct effect on skin quality, especially in those areas where they go a very fast degradation, hydrolysis as well, okay? But here we have the implant, the solid one, which is preserved inside the tissues for a long time, okay? So once again, to tell you, so what is the Nano Uniqa? This is the safe solution for the delicate, dangerous areas. Safe plan insertion, the blunt tip cannula, minimal trauma, regenerative and preservative rejuvenation. This is the smooth integration, no volumizing effect, and collagen and elastin stimulation as well. And once again, this is the first thread ever that you can use in a very, very delicate areas that you have never ever imagined. It's like the glabella, the periorbital area, the smoker lines, the nasolabial folds, superficial one, not heavy one, okay? We're not talking about the heavy wrinkles. Those Nano Uniqa threads are for only biostimulation. They don't give you the filling effect, no, or volumizing effect, no. They give you only the biostimulation of the areas. Okay, so thank you very much for your attention. And now I'm moving to the live demonstration room where I will show you how we're going to use those threads. In case you will have questions, please leave in the chat, and then I will answer your questions. I will need 3 minutes and I will return to you back from the operating room, okay? Thank you. Patient for Nano Uniqa treatment. What we are going to do now, we are going to use Nano Uniqa S 5.5 size length for periorbital area and for the marionette lines. So what we are going to use, we have wrinkles, ცოტა დაზუმე გია. კიდევ, აქ სახეს არ ვაკეთებ, თვალებს ვაკეთებ. So we have problems here, superficial wrinkles, გაიღიმეთ, კარგად გაიღიმეთ. You see, here as well and here as well. So we are going to use 5 threads from this entry point, from here. I will use all these areas like that. And this. Okay, here we will be using 5. This is one package, and I will use one package for the marionette lines as well. Გავშვით. Here for the stimulation, and we'll use fan technique. 5 like this, and 5. ხვეწები მაგენი არა ჩვენო მაქა. არა. გეტყვი ხა, კაი გაშალდა. 5 and another 5 as well. Here. We'll use for the stimulation of this area, and we will inject a bit here as well. Okay, that's a kit. Whole steriluri ხელთათმანები არ ჭირდება სახე დამუშავება მინდა მარტო. არა, რატო? არა, შესასვლელი ნემსი გასაჩქლეტი 18 დიდია. ვიკუსი. რომელს ვიყენებთ 25-ი? ხო გახსოვს? შენი აწყობილი პრეზენტაცია ეგ ვიკუ.
So, ეს მაგიდა არ მინახოთ, არ მიჩვენოთ. მომეცი, ისა ლურჯი აიღე მაშინ. ან ყვითელი. რომელს იყენებს, არ გითხრა, რას იყენებს, რამდენჯია.
23 არის ეს.
მომეცი, 23ჯია. თუ არა და 18ჯიც გამიხსენ. Okay. So, we don't need too much of preparation for that. ბიორევიტალიზაცია გაიკეთებიათ. მე ესეთია ეს. ზუსტად. აბა რა გეგონათ თქვენ. მე ხო აგიხსნეს რომ ეგეთი არ არის. ეგ არის არა, ადგილობრივი ანესთეზია. დამშვიდით. ხო გეუბნებით, ეს რომ უფრო მტკივნეული იყოს, გეტყოდით. ეხლა ძალიან არ გახსნა ვიკა, მომეცი ტუფერი და მიკროდაცინი. სად არის ტუფერი? Dear colleagues, so this is the threads we are going to use. So in the package we have two of them. 5, 5. უთვალ დახუჭეთ ერთი თუ ჩაგეწუნწყლათ. დამშვიდით თუ შეიძლება. Here we are, we will clean it. So მოიწიე, მაგრამ მაგიდა არ ანახო. არ მოიწიე მაგიდით. ვიკა, აგერ. მოდი ასე. მონერვიო. Right, პირველად. Then აი გადამბრუნეთ. გვერდზე. We make a puncture. 1, 2, 3, ჭყლეტა. არ მინდა. And look at this. გტკივათ? ცოტა. ვასატანია. Here we are. Look at this. მოგივით მე ისეთი კარგი გექნებათ 2-3 კვირაში. That's all. We don't touch the cannula. Okay, we only touch the tip. გამიხილეთ თვალი აბა? აი ეს. Now I'm going to be a bit more superficial. დამიზუმეგიო. მომიდუნდით ახლა. ცოტა გეტკინებათ. ცოტა. ხო ხართ კარგად. მოდუნდით ახლა. მოდუნდით. ხო არ გტკივათ ახლა. So. Last one. ბოლო აქა. Some points. Well, a bit can be a bit sensitive. Okay, now ნიკაპი მაღლა. პირველი პაციენტი ხართ ასეთ რაღაცაზე, რომ იმაშვებით. Всё, მოდუნდით, ახლა თქვენ დაძაბული ხართ, იმიტომ აწიეთ თავი. ნიკაპი ამიწიეთ, გთხოვთ. You know, you need to have some luck with the patients as well. With such a small thread, this is the first patient so sensitive. მოდუნდით, კრიჭა გაქვთ ჩეკრული. ივათ ახლა? მერე შო დამშვიდით, ახლა მოდუნდით. Всё, ხო ხართ კარგად. ვაწვევი და იგივე ნაწილში შევდიო, როგორ შეიძლება იყოს ისევ მტკივნეული. I will ask now. So you see, just want to show you. I left outside. Look at this. You see? იწოლიტოთ უნდა დამშვიდით ახლა კიდევ ერთი აწიეთ ნიკაპი მაღლა და მომეცით რომ აწიეთ თავი მაღლა ახლა აი ნიკაპი აწიეთ მაღლა თუდად ხო არ ხართ აწიეთ თავი აი დედას გეფიცებით პირველი ხართ ვინც ასეთ პატარა ძაფზე ისაქნა 1 2 3 ოჩა and now I will crisscross ოჩა You see how superficially I inject. Patient is more sensitive than it's painful. It's not, but patient is also doctor, so she's sensitive on the movements of the threads. But we know that this type of the threads, we do the boosters with that cannula as well, and it's not painful. მეორე მხარეს გადმოწიეთ თავი ახლა. რა ქვია თქვენ ამით ხარით? ათონა. თავი გადამიბრუნეთ იქით. ცენტრში მოიტანეთ თავი. დადეთ თავი და გადააბრუნეთ. ნიკაპი ამიწეთ და თუ მომცემთ საშუალებას მუშაობის, მალე დავასრულებთ. არა, მთავარია რომ ახლა მე ხო ვფიქრობ თქვენზე, იმიტომ კი არა რომ მე მეჩქარება. 1 2 3 თუ ეს ერთად არ მეჩქარება, ოჩახ. Okay. თქვენ მოძრაობებზე ხართ, მე მგონი უფრო ის დამშვიდით. Here we are. And now I want to inject in that horizontal wrinkle. რამდენი ხანი ქონდა ემლა წასმული? მოგეშინიათ. 200 კაცი გვესწრება ახლა, ყველა დააფრთხეთ აბსოლუტურად. იმიტომ რომ ეს არის ისეთი ძაფი, რომელსაც აი პირველი პაციენტი ხართ, ვინც ესე იძახის და აი რაღაცნაირად იცით, როცა გეშინიათ, უნდა შეიკავოთ თავი. ეხლა მე შუა გზაში ხوار დაგტოვებთ. აწიეთ ნიკაპი. ისა გიო ნიკაპზე გადადი. ოჩახ. მოდუნდით. Here we are. Another entry point is here. So I will crisscross with this threads. Dear colleagues, I'm waiting for your questions in the chat if you have them. If not, you have amazing representative in Georgia, Nini, which she will guide and help you in case you have any doubts or questions. Another entry point. Paraugoni. Previously injected threads. Now I will crisscross. Kamishwikit. There is it. We don't touch the cannel as you see. We just touch the and that's all. I will move to that area. That's all. Now we will clean her face. And that's all. Castoret camera. We don't have any hematomas. We don't have bruising, nothing. A small entry point. On the entry point, you have a drop of the blood, and that's all. Here we are. Finish. So, madloba didi. So, dear colleagues, we finished our procedure, and now let's see the questions. Arara, es arara kitkhwebi. Ah, es kitkhwebi arari. Ah, okay. სადარი დიტო გამიჩენ. იპოვე? Dear colleagues, we are unable to read your questions. I don't understand why you are writing here your emails.
Murat,
Unable, a lot of them.
ეგ გვჭირდებოდა ერთი სახელით არიან შემოსულები და მაგიტო დავაწერინე თავის
ხო,
სახელით.
ნინი არ მოაწერინო, იმიტომ რომ წარმოუდგენელი ახლა
არა, ეგ მე მჭირდებოდა უეჭველი. Question and answers რო არის, მანდ არის კითხვები თუ გახსნი საიტი დაინახავ.
ჩართე. Okay, then we will go only for the question and answers. Good morning, doctor. If a patient has tear throat, then it would replace the filler. We can directly do the threads, or we need to do filler first and then threads for biostimulation. Dear colleague, these threads do not replace the filler. But if you want to use them in a combination, first you do the filler and then you do the Nano Uniqa threads. They don't replace the filler. We talked about this because Nano Uniqa is for the superficial usage, for the fine wrinkles in that area, for the improvement of the skin structure. laxity, and so on and so on. Was topical anesthesia cream applied? Dr. Paul, I mentioned that it was applied, yes. Can you explain about the locations of the entry points? How are you anchoring the threads? Dr. Navia Paul, I think that you missed the part I several times mentioned that we don't have entry points for that threads. And this is the small threads, smooth, for hypodermal injection. What type of the anchorage we are going to talk about? No, we don't anchor it, and we don't have entry points. We have the only entry point where we see the problem, we inject exactly from there, and that's all. Dr. Ritu, can we get them on forehead thread lift as well? I will think about if we have it, and they will send it to you. Dr. Sharma, with fillers we avoid the jaw, but with Nano Uniqa injecting over the jaw, how does it change the jaw? You can inject inside the jaw, Dr. Sharma, no problems with that, because this is not for the contouring of the jaw, but this is, if for example you have the fine wrinkles in the jaw area, you can inject it, it's okay. Shendegi? It's not heavy material. Okay, Dr. Amit, dear Murat, thank you for the demo. Thank you, Dr. Amit. I have few questions. How long does it take to appreciate the skin quality improvements? You will see the changes also on the 2 weeks, sometimes on the 1 week as well. Better it becomes after 1 month and 2 months and so on. Does it also help in a little stretch over fine lines? Yes, it's mostly for the fine lines, mostly. But not for dynamic wrinkles. I mean, dynamic wrinkles is for toxin, but this is for fine wrinkles exactly, and they work really very well. More results you want to receive, more threads you use, 5, 10, 15, 20 in the area. For the necklines, is it recommended to go directly under the crease or place it across the crease? Both of them. You can inject exactly in the wrinkle, the crisscross as well, wherever you want. Both of them are acceptable. With both of them, the best results. I always combine. First of all, go directly in and then crisscrossing. The fourth one, can a filler be done in the same area, in the same session? If yes, is it filler first or Nano Uniqa? Can be done fillers first, because fillers are in a deeper layers, but with Nano Uniqa you need to be very superficial. Is it the topical anesthesia recommended before the treatment? You see my patient, this is the thread, really not painful at all, really, that's all. But the patient was a bit anxious, you see, and she had topical anesthesia. And can you imagine if she didn't have the topical anesthesia? For some type of the patient, this happens is like 0.5%. I suggest you to use, it's better. But in my practice, I've done without topical anesthesia as well, because we are doing fillers with the cannulas and we are not using the topical anesthesia. The same is here, okay? So it's your choice. Dr. Murat, Dr. Gampa, Dr. Murat, are they indicated for under eye hollow or medial side of eye? If so, what is the approach? It's not recommended for the correction or the volumization of the under eye hollow, but for the skin on that area, for skin. Let's say like this, to explain you once again, this is for the skin improvement, not for the volumization, not for the filling the under eye hollows, no. But yes, you can use them in the under eye hollow for the skin improvement only. After how many days later, Dr. Sharma, after how many days later of the procedure we can do EBD or hydrofacial? Well, to avoid some uncontrolled complications, we didn't have the evidences yet, but to avoid it, better after 1 month. Dr. Sharma, thank you very much. Thank you very much. And what are the complications or adverse effects can we expect? We are using them for a long time already, but honestly, I will tell you, we didn't receive any
complications. There was the small inflammation at the entry point because doctor who performed this, she was all the time with non-sterile gloves touching the cannula. So this procedure doesn't need the classical preparation for the threads as we do with the other threads. No, you can do it with the non-sterile gloves as well. But the thing is that you don't touch the cannula like with the fillers, and you will avoid all the type of the complications. And logically, you will not have the complications with that. Not that much. Maximum, there can be infection if it's done in totally antiseptic, how to say, with the total violence of the asepsis and anti-asepsis rules. No, Dr. Sharma, we don't give antibiotics. There is no need. You see, we just cleaned it and with the gloves injected, that's all. Dr. Sharma, what is the reason to use for the nose? So for the nose, we need the lifting, the volumization, but these threads are not for the volume and the lifting. And I think there is no need to improve the skin quality on the nose. So that's why we don't use them there. Okay, so dear Dr. Murat, have you encountered any post-procedure? Said no. Dr. Harish, no, we didn't. Wonderful, thank you, Dr. Nimi. Yeah, oh, look, we can use not for the lips, but for the smoker lines. For the lips, it's painful, first of all, because its cannula is painful for the lips. But for the smoker lines, you can use it. For upper eyelids, yes, 100%. For ears, no, there is no need. But for the periauricular area, yes. Dr. Sharma, no, this is not the threads for the lifting. Once again, I think that you didn't get the point of those threads. These threads are not for the lifting. This is the threads for the skin rejuvenation, skin improvement. No, Dr. Nimi, no for the nose. This is not the threads for the improvement of the nose shape. Dr. Puja, thank you, Dr. Murat and Dr. Nini, thank you very much, dear colleagues. Can we use same threads for scalp in female and male with androgenic alopecia and any contraindication? For the androgenic alopecia, Dr. Reddy, we don't have any evidences of the improvement. We don't know yet. Dr. Sharma, Dr. Vilas Sharma, very good question. Yes, for the acne scars, you can use them for the improvement. But please remember that this is the very delicate cannulas and the acne scars are very tough, for injection. If you will be able to inject it there easily, yes, this is a good decision. You can use not only 5 threads or 10, you can use 20, 15, cover the whole face with them, and you will receive a very good results. Dr. Sharma, there is no entry points, specific entry points. Wherever you want, wherever you see the problem, you measure the length of the cannula and the area and inject it. Okay, any other questions? Jorgam, kuchawinime. Dr. Nimi, I answered you about the scalp, that we don't know for the hair growth if it works well or not. We don't know yet. But you may be the first one who can try it and then to inform us if it had because we are not specialized for the trichology or the hair growth expertise. So if you have any evidences about this, any information, we will be happy to receive the information from you. So, dear colleagues, thank you very much. Honestly, I will tell you that I love this part of the world where you are now being there and watching my webinar. Amazing country, amazing culture in those areas in general. So thank you very much for watching us, for listening us. If you have any questions, so Nini is there. She's amazing. So go to the questions with her and we will try to answer you. Thank you very much.